Mm-hmm. Oh yeah. So with Discoid lupus, it's an autoimmune condition, which means the cells that typically fight infection, they then attack different areas of your skin. And so Discoid lupus is a cutaneous type, meaning it's limited to the skin. Now, most people who have discoid lupus only have it in the skin. So, about 5% of people, though, with this condition also have systemic lupus, meaning that they have lupus that affects other organs. So, the other organs that lupus can commonly affect: the kidneys, the heart. So, oftentimes, if someone is diagnosed with discoid lupus, we may do blood work to see if that blood work is positive, which may be an indicator that they have systemic lupus. And in addition to seeing a dermatologist, they would want to see another specialist, right? A rheumatologist or a organ-specific specialist, a kidney specialist or a cardiologist, that type of thing. Really, I mean, the way that we treat it is trying to calm down the inflammation in the skin. And we do that with different things. So scalp injections, right? Different types of topical anti-inflammatory, so different types of steroids and other forms outside of injection. But Plaquenil is also commonly used. The other name for that is hydroxychloroquine. So that medication got a lot of attention 2 years ago, 3 years ago with COVID, because that was one of the treatments that they considered in being a treatment for COVID. Mm-hmm. And so Plaquenil is actually very well tolerated. It's also used as malarial prevention if you're traveling to Africa, for example. So it's a very commonly prescribed medication, very well tolerated. The biggest thing is it can cause vision changes, rarely, but it's possible. So you get an eye exam before you start it, and then 6 months into treatment to make sure your eyes are adjusting well to the medicine. But most people, I've not ever had to stop a patient on Plaquenil from those eye changes. So that happens rarely, but that's kind of the most feared side effect of that medication.
Okay.